What is dementia and how does it occur? Are you forgetting things quite often? What to do and how to slower the process of dementia. The most important is how to deal with dementia patient once suffered from it. This question sparks curiosity in many minds. Dementia, a term that many of us are familiar with, yet it remains enigmatic and often misunderstood. Dementia isn't simply a disease, rather it's an umbrella term that encompasses a wide range of cognitive impairments, including memory loss and reasoning difficulties. It's a progressive condition that tends to get worse over time, but how does it occur? The onset of dementia results from damage to brain cells, which affects their ability to communicate with each other. And this disruption in communication can affect thinking, behaviour and feelings, and the cause of the cell damage varies depending on the type of dementia. In Alzheimer's disease, for example, it's believed that abnormal protein deposits in the brain lead to the death of brain cells. Vascular dementia is caused by reduced blood flow to the brain, which damages and eventually kills brain cells. This can happen as a result of narrowing and blockage of the small blood vessels inside the brain. A single stroke where the blood supply to part of the brain is suddenly cut off. Lots of mini strokes that cause tiny but widespread damage to the brain, but not everyone who has a stroke will go on to develop vascular dementia. Dementia is not a normal part of aging, although age is the strongest known risk factor. Most people with Alzheimer's, the most common type of dementia, are over the age of 65. However, early onset Alzheimer's can occur in people in their 40s or 50s. Now, one might wonder, are there ways to slow the progression of dementia? While there is currently no cure for most types of dementia, certain lifestyle changes can help delay the onset and slow the progression. Regular physical activity, a balanced diet, sleep well, stress management, maintaining social engagement, and mental stimulation in the way to continue learning new things and challenging your brain can all contribute to brain health. Certain conditions can also contribute to the onset of dementia. These include heart disease, diabetes, stroke, depression, and even social isolation. Early detection and management of these conditions can help in reducing the risk of developing dementia. Now, very important here is caring for someone with dementia can be challenging. Eventually, people with these diseases will need more help with simple everyday tasks. This may include bathing, grooming and dressing. It may be upsetting to the person to need help with such personal activities. Here are a few tips to consider early on, and as the disease progresses, try to keep a routine such as bathing, dressing and eating at the same time each day. Help the person write down to-do lists, appointments and events in a notebook or calendar. Plan activities that the person enjoys and try to do them at the same time each day. And consider a system or reminders for helping those who must take medications regularly. When dressing or bathing, allow the person to do as much as possible. Buy loose-fitting, comfortable, easy-to-use clothing, such as clothes with elastic waistbands, fabric fasteners, or large zipper pulls instead of shoelaces, buttons, or buckles. Use a sturdy shower chair to support a person who is unsteady and to prevent falls. You can buy shower chairs at drugstores and medical supply stores. Be gentle and respectful. Tell the person what you are going to do, step by step, while you help them bathe or get dressed. Serve meals in a consistent, familiar place and give the person enough time to eat. It also involves understanding the person's needs, ensuring their safety, providing emotional support, and helping them maintain their self-esteem and independence as much as possible. Communication can be hard for people with Alzheimer's and related dementias because they have trouble remembering things. Reassure the person, speak calmly, listen to his or her concerns and frustrations. Try to show that you understand if the person is angry or fearful. Keep well-loved objects and photographs around the house to help the person feel more secure. Remind the person who you are if he or she doesn't remember, but try not to say, "Don't you remember?" In conclusion, dementia is a complex, progressive condition that arises from damage to brain cells. It's most common in older adults, but can affect younger individuals as well. Lifestyle changes can help slow its progression, and managing risk factors can reduce its onset. Caring for someone with dementia requires understanding, patience, and support. Remember, every journey with dementia is unique, and understanding it is the first step towards managing it effectively. Thanks for watching.